This video will be about distributive shock. Some background on distributive shock is that it is caused by excessive dilation that causes inadequate tissue perfusion. And some of the causes of distributive shock are sepsis, that's being the most common, pancreatitis, and anaphylaxis. It results in organ dysfunction, and it's very, very similar to septic shock. The mortality rate is around 30% if the shock is treated and 80% if untreated. Some symptoms are tachycardia, warm extremities, a bounding pulse, decreased urinary output, tachypnea, altered mental status, fever is possible, abdominal pain is possible, and nausea and vomiting. The hemodynamics are going to be monitored using a Swan-Ganz catheter, and the patient will be hypotensive. The pulmonary capillary wedge pressure will either be normal or decreased. The cardiac output will be increased. The SVR will be decreased. The mean arterial pressure will be normal or decreased. The CVP will be normal or decreased. And the venous oxygen will be decreased. Some medication options are antibiotics to fight the infection, and that's if the shock is caused by sepsis or an infection in the blood. Vasopressors will be used to augment the coronary and cerebral blood flow to increase the venous return and cardiac output. The steroids are used if the patient does not respond to vasopressors, and this is going to decrease the inflammation to help with blood flow. And you will give the patient oxygen to improve oxygenation status. With an ABG, you will likely see a respiratory alkalosis with a low bicarb and hypoxemia. The pH is going to be high, the CO2 will be low, the bicarb will be low, and O2 will be low. Ventilator treatment for these patients, you will likely use invasive mechanical ventilation to secure the airway, so the patient will need to be intubated. The positive pressure ventilation is okay as long as it's in a low setting, and that would be less than 14 centimeters of water. Initially, you will need full ventilator support, and you're going to base your settings off of the needs of the patient from the ABG result, and the tidal volume will be between the normal 6 to 8 mLs per kg of ideal body weight. Here are my sources.